Larry Johnson. I'm the commissioner for DeKalb County, Georgia, and also I pleasure serving as the NACo first vice president. On behalf of NACo, I would like to welcome you all today to this webinar, Changing COVID Conversation, Community Strategies for Local Governments. Before we get started, I want to go over a few housekeeping items. We want the seminar to be interactive, so please feel free to comment and pose questions to the speaker in the chat, or you can do it directly. We have a very good panel today, and they're willing to answer questions directly. We're not asking questions. We ask that you please stay muted. The focus of today's webinar is both important and timely. We will hear from experts on how to develop an effective communication strategies around COVID-19 that will help build public trust in your health messaging. Counties have been on the front line of this public health crisis from the beginning. As one of the biggest roles we play as catalysts and conveners as public servants is to position ourselves as a trusted voice, that we have the ability to overcome political divisions and instill confidence in our communities. The role becomes especially critical now as we overcome the skepticism and the hesitancy around the COVID-19 vaccinations. Creating public confidence in a vaccine, communicating with our residents, and strengthening the trust of local health agencies is essential to eradicating this virus, which is why I'm so pleased to introduce our special guests today, Dr. Frank Luntz and Brian Castucci. Frank Luntz, you all know he's a superstar. I've had a chance to see him in action on TV in many occasions. He's a most honored communication professional in America. Frank has worked in more than 50 Fortune 500 companies and with CEOs, but he's best known for his political commentary. More media outlets have turned to Dr. Luntz to understand the hows and fears of Americans than any other political pollster. Dr. Luntz has overseen more than 2,500 surveys, focus group, ad tests, dial sessions in more than 24 countries for over 20 years. His political knowledge and skills and acumen is recognized globally, and he has served as an election consultant and commentator around the world. Our other special guest is Brian Castucci. He's an award-winning epidemiologist with 10 years of experience in the state and local health departments. He brings a unique background that allows him to shape initiatives and partnerships that bring together research and practices to improve public health. Over the past 6 years, Brian has helped to build the Beaumont Foundation into a national powerhouse in public health philanthropy and advocacy. He now serves as the foundation acting CEO. Under his leadership, this foundation is the driving change to improve and foster collaboration between public health and other sectors. Thank you both for taking the time out of your busy schedule to participate in this today's webinar. NACo appreciates you. And before we begin, I want to remind you to enter your questions for our speakers into the chat box when appropriate. You can also unmute yourself and ask your question directly. Just make sure you introduce yourself first. With that, I turn it over to our special guests.
Brian, I assume I go first?
Yes, sir.
Okay, and I promise not to take too long because I know that Brian's the smart one here. I'm the one who's I'm here for entertainment. I'm the one who's more likely to tell any appropriate jokes, and Brian's going to tell you what you need to know in terms of the facts. But this is my first Zoom call. I've been in the Middle East for the last 10 days. It's nice to be back where it is cold as hell and snowing. And Commissioner Johnson, I'm actually coming down to your state over the next few days to witness political chaos in action. It's funny that you say that you're the only person that your organization, the county, is the only people that people trust. You're actually correct, that they don't trust the federal, they question the state, and the more local you are, the more likely they are to trust you. So I'm going to walk through some key findings. We're going to do 2 separate segments because I want to give people the chance to ask questions. So I can pull it up now. I'm going to just walk you through a few slides, take a couple questions, walk you through a few more slides, and then turn it over to Brian. Hold on one second so you can get full screen. the key aspect, there are 5 key points that I want to emphasize because so many of the governors are not doing this. And I used to be very pro-governor, and now I wonder. I wonder because they should be taking a back seat, and they should be letting the health experts front and center. Whenever there is a health expert or politician in the room, the politician should do about 20%, and the health experts should be doing about 80%. Unfortunately, it's exactly the opposite right now. The communication that's coming out of Washington is really atrocious. And the more that I do these presentations, the angrier that I get because the more clear the recommendations are. First, it cannot just be about the consequences. You cannot scare people into submission. It's got to be some positive and some negative. And I use the Oreo cookie example that you start with the challenge, with the danger. You then give them something positive, and then you end once again with the if they don't do it, the consequences of it. If you do not have something positive about life, about returning to normal, about reopening our lives, reopening the economy, about being safe and sensible, if there isn't a positive in your communication, you will fail. You will freeze people. You will cause them into inaction. We know that we've got a segment of the population, and I avoid politics and partisanship studiously. But let's be candid. There is a political segment that does not take this virus seriously and is even hostile to simple things like wearing masks and social distancing. And so this language is meant to address those people. And there's another segment of society that isn't hostile to it, but doesn't treat it as seriously as they could. So this is trying to thread that needle between left and right, between urban and suburban, between young and old, between men and women. So keep that in mind. This is not language that's meant to appeal to just Democrats or just Republicans or just urban areas or just suburban areas. It's meant to thread that needle. Second, it cannot just be about the national. It also has to be about the personal and the human component, that you actually have to get people to think, what does this mean to me, myself? And there's a word in there that I don't know if I put into the overall communication, but it's the word imagine. Imagine what would happen to your family if you were suddenly to become sick. Imagine what happens if you end up in the hospital for 2 weeks. When you ask people to imagine it, they personalize it, they individualize it, and then it's critical to your communication. Third, it's got to be more than just they themselves. That there are some people who will not act, and there's no way to push them until they realize that they're jeopardizing their family, they're jeopardizing their friends. For those people, it's the bigger world around them. So it's not enough just for you to talk about, hey, get vaccinated because it'll save your life. For some people, it has to be the impact that it has around people who are around them. Next, it really has to communicate the words every and all. And those of you who are taking notes, this is really important. That there is the feeling now that some communities are being left behind or being ignored or being forgotten. That people need to know that they matter, their neighborhood matters, their community matters. They need to be able to see themselves in your communication. And what they will not accept is if this becomes an issue to beat up on the president or attack some governor, that in the end, it doesn't matter whether you are a Republican or Democrat. Although I'll tell you that there's a big difference among those who know someone who's died of COVID. And since I may not get to that slide, 18% of Republicans know someone who died of the virus, 30% of Democrats. And you'll see that that's an urban versus rural factor, that this is a racial factor, that many more African Americans know people who've died than white Americans. But I want you to keep the partisanship out of it. I commented on what's going on in Washington because I'm a pollster. You shouldn't. There's no reason to do so. And finally, the key, and again, I say quite frankly, because I know that there are a number of people on here who are focused on the urban areas. One of the biggest challenges you actually have is among Republicans who argue that there's no reason to do any of this because, and I quote, the science isn't settled. And that's one of the keywords that you need to use in your briefings. The science is settled. You can't leave that open for interpretation, because if you do, you will not get the participation that you want. Now, I'm going to put up the next slide and we're going to go through this. But as I want to make this interactive, Commissioner Johnson, I'm going to turn it back to you. I'll leave this slide up for a second. Hopefully there's a question or two. Then we'll go back to this and I'll talk about this individually. But these are the key words on a single page that I'm urging you to use in your communication. Commissioner.
Thank you so much, Dr. Luntz. I appreciate your insight. I'm going to turn it over to Brian and take it away.
Thank you. I mean, from our perspective, you know, the county commissioners have such an important role to play as we move forward in our COVID-19 response. We are fortunate that there is a light at the end of this tunnel, but this tunnel is still very long. And using the right words can help us get folks to adopt the behaviors that we want, and, you know, more importantly, prevent additional death. And I think one of the things that has resonated with the public health officials is keeping those numbers local, sharing those, you know, really hyper local numbers, and don't necessarily use rates. You know, it's a law of large numbers problem. If you lose, you know, 10% of the US population, well, 10% doesn't sound like a lot until you realize it's 40 million people. So we need to get real numbers to people and give them, you know, this language to help them make the right decisions. So really, I think that the best thing now is for folks to ask questions. It's really the best way for everyone to get a sense of how to best use this language. Other briefings that we've done, that's when a lot of the really interesting conversation happens. So I think it's just best to open it to broad questions.
Great, great. All right, NACo family, we're opening it up. We have two great presenters who have given us some food for thought. Do we have any questions? You can ask one in the chat, or you can unmute yourself and the NACo staff will acknowledge you and we can go forward. And while we're waiting, I'll ask a question if you don't mind. I'm down here in DeKalb County, Georgia, and that's the home of CDC. And of course, we have ground zero for the elections. Dr. Luntz or Brian, how the word trust keeps coming up. You know, my district is about 90% African-American. How do we get the trust factor out about the vaccination, the vaccine?
Well, the first thing is that it's the people who are the spokespeople. It's you and your colleagues. And you talk about either earning their trust or deserving their trust, and probably earning stronger. That you have to demonstrate through your articulation that you have done these things before and they have been successful. We've earned the trust of our community, and it's never mattered more now than it has at any point. And in fact, after you've done, we understand we have to earn your trust. I'm going to pull up that slide again and give you three examples. Fact-based. It's not evidence-based. I know that science and the health professionals love to use evidence-based. The problem is the public sees evidence for the prosecution, evidence for the defense. They think about it in legal terms, and you can argue over the evidence, but people don't argue over the facts, which is why fact-based is preferred to evidence-based by almost 2 to 1. Second is that the goal needs to be articulated. And I've had disagreement on occasion. Your mission is to eliminate and eradicate the pandemic. I know that there are health experts who will say, but that'll never happen. We cannot completely eliminate it. We can reduce it. We can control it. We can minimize it. But that word eliminate doesn't work with them. Well, it should, because then at least add the word mission before it, because in the end, it's the reason why the public will pay for cures, but they won't pay for treatment. They won't pay to live with the disease, but they'll pay to eliminate the disease. So I urge you, it's a combination of eliminate and eradicate. And if you need to make it a mission, then that's fine. And third, if you tell them that it's mandates, if you tell them that they must do something, they will feel like they've been imprisoned and you've thrown away the keys. What we have found, it's far better to use the phrase protocol than it is mandate. A protocol is a rule and a regulation. A mandate is a government telling you what you can and cannot do. And you'll get people who rebel because of that. And one last one, because this is the one that we're not dealing with right now. If you call it a lockdown, you have to expect that 30 to 40% of the people in your constituency will reject it, because a lockdown takes away their freedom of choice, takes away their personal responsibility, and it's basically a decision being forced on them. If you call it a shelter at home, so it's a shelter at home, we are administering a shelter at home protocol, is acceptable to people who will deny that there should be a system-wide lockdown, just by changing the words. And I'll show you that slide in a moment. But just by adding those 3 or 4 words, you will earn the faith, the trust, the confidence of the people that you serve.
Thank you, sir.
The only thing I would add is that, Morning Consult had a poll out a couple days ago that showed friends and family will drive that trust. So I encourage, everyone on this call who is a county commissioner, you are indelibly linked to your local communities. We shouldn't wait for Michelle Obama or Oprah or anyone else to take the vaccine as some gateway that then everyone will take it. This isn't polio and Elvis getting the polio vaccine. We need friends and family. I need, every county commissioner bringing community leaders together and using some of the language that I've learned from Frank around the, ifs and becauses. So, if we want to get past this pandemic, we need to take the virus, we need to take the vaccine, and having people really out there in front, leaders in the community, not people who are on TV, leaders in the community saying, because I don't want any more people to die, I will take this vaccine when it is available to me. And I think if county commissioners brought those leaders together, gave them that messaging, and then sent them out, you would see a real impact.
And I'll add one comment to what Brian just said. Because I don't want to attend another funeral of someone I know. It's that simple. And I get really agitated because we tend to blame the public for ignoring what's being said. Well, I actually hold accountable those who do the speaking, starting from the very top and working its way down. There is a way to communicate what the public will listen to. And that personalization, because I don't want to attend another funeral of someone I know, actually triggers people's willingness to act. So if you ignore that, if our leaders ignore that language, then they shouldn't be surprised if it just simply falls on deaf ears and people don't listen.
Thank you. Blair, any more questions? Anybody from our audience, please?
Yes, I was just going to jump in. We have a few audience remarks and questions. The first one comes from Caleb. And Caleb, feel free to unmute if you want to ask this question directly, or I can read it out loud. But it says our PIO staff is concerned that our public health and elected officials' words are falling on deaf ears, especially on mask use. Do we need new messengers?
I believe you need new messaging, even more than new messengers. And I want to give you another example. I'm going to use your question once again to go back to the language. We actually looked at words to use and lose. Instead of emphasizing how quickly this vaccine was developed, which is happening way too often among the politicians, what the public wants to know is that it is safe and effective. Speed actually cuts credibility. They would prefer that it have gone through all the elements of oversight and transparency and accountability than it got to market a few weeks earlier. Second, if they're nervous about mask use, or and by the way, mask use is better than facial coverings. Social distancing is better than physical distancing. I'm seeing particularly politicians start to change the language because they're bored with the old wording. And we can show you that in each of these cases, the difference is 10, 15, 20%, sometimes even more. Essential workers, when you talk about frontline workers, nobody knows what a frontline worker is. An essential worker, everyone's got it. Everyone, and in fact, some people think that they're essential workers. The great thing about essential workers is that it describes what they are in a positive way, in a way that makes people sympathetic to them. And one more, because I know it matters to those of you on this call. Call it a government health agency, and you are right in the middle of the political divide. Call it a public health agency, and you are trying to serve everyone, not one side or the other, not government or the other. A government health agency is a bureaucracy. A public health agency helps people. Now, I know that that is not true in reality, but we don't have time to re-educate people right now. What we need to do is get people to act in a safe and sensible fashion. So the words on the left will get them to do it. The words on the right are causing the problem. And the words on the right are being used all across America today.
And I would just add that, we as public health officials have not really done a great job with our messaging. We've said, wear a mask. But that's kind of been it. We've not really given them that personal value proposition of why should we be wearing the masks? How close we are to actually getting to the end of this pandemic. We are within, earshot of getting there. We must give that if-then, those personal statements. Continue to wear a mask so that, just like with Christmas, stay socially distant during Christmas so that we're here to celebrate next Christmas. You find ways to engage them more than just the order of you should wear a mask.
Thank you, Brian. And Dr. Luntz, one more audience comment. This is from one of our participants. I have COVID right now, and I found getting concise, factual information is very difficult to find. The Department of Public Health, doctors, and the CDC all have conflicting information that they give out to the public. When even your medical community can't all align, who do you trust in giving out the info? Questions: how long to wait to get tested from exposure, retesting for reentry to work. Many say not to get tested to come back to work because it can stay in your system for a long period of time. Even healthcare workers are not getting retested to go back to work. There's a disconnect between medical opinions and the real world application, which is what I believe.
Brian, I'm going to let you handle that. I'm only going to offer one strategy, which is everyone, I think I know the responsibilities of people on this call. You should produce a Q&A, and it goes on your website. Q&As are the most read, the most comprehended, and the most followed way of communication of any when it comes to healthcare. And I'd say if you are committed to this, 48 hours from now, there'll be a Q&A that will help clarify this. Now, I can't fix the problem of health experts disagreeing, because politicians disagree, lawyers disagree, every profession disagrees. I can't fix that, but I can fix the retention and the cooperation from the public. Please create a Q&A, and that will go a long way towards those who are inquiring, at least from you. It'll go a long way towards them following you.
So this has probably been the most challenging part of COVID-19. I don't think it's that people are anti-science or science deniers, but unfortunately there are enough physicians and public health experts with different points of view that some of these facts have become opinions, and that's really challenging. Default back to the CDC. And the hard part here is really hit the idea of a novel virus. I don't think most people know what it's like. COVID-19, I've asked people, what is that 19? It's like, there are 19 DNA strands, there are 19 viruses. No, it's the year that we found the virus. And so I don't think people always understand novel either. So we're learning, right? And we probably came out too strong in February with what we knew when we didn't know as much as we thought we knew. And that's been how we've kind of flip-flopped on masks. Don't wear a mask, no, wear a mask for other people. Oh, wear a mask for you too. So I think going with that CDC guidance, that is our best science that we have. And then interpret that to your local community and make the use of it and say, this is what CDC is saying, here's how we apply it, and really rely on your public health experts and the folks in those health departments. I just shared in the chat another resource that could be helpful, something called the Public Health Communications Collaborative. It is developing messaging and infographics. It has regular webinars to answer messaging questions. And we even have some money in our budget to do some one-on-one technical assistance if necessary. So I encourage everyone to visit publichealthcollaborative.org and sign up for the listserv. But there's a lot of good information coming out of that group.
Wonderful. A few more questions from the chat. And then again, I encourage anyone to unmute if they have additional questions as well. So a follow-up question to the question from Caleb. Do you recommend addressing or ignoring the more outrageous conspiracy theories regarding vaccinations? We have a high anti-vaccination rate from a traditionally liberal point of view, even before the pandemic.
Wow, I thought you were going to blame conservatives. You got a high conservative rate also from people who simply don't trust anything from the government. We're all screwed. They're all nuts. I say to you, don't respond to the nutcases, because all it'll do is you'll say something that'll suck you into a vortex, into a black hole, and you'll never get out of it. That there's going to be, unfortunately, I used to say it's 5 to 10%. Now it's 10 to 15% of the American population that's nuts. And they're just not going to, whatever you say to them, they're going to send to 100 people along with their own interpretation. They're going to re-edit you. Don't engage. This is what I'd like. This statement right here, this page, is what I would desperately want you to say. And I'll leave this up. And Brian, you're high enough on my screen so they can see you as I leave this up. I think this is also a health decision, not just a communication decision, but I'm against responding to those people. This is what I would really want you to say.
Yeah, no, Frank's right. I mean, I worked in government for 10 years, and now even not in government, we're putting stuff out as the Beaumont, and the trolls come. And when I was I actually worked for the Department of Health in Georgia, in Atlanta, and had a woman tell me that, I killed her daughter because we put fluoride in the water. And there is no discussing that, right? Just think of it. This is how I tend to think of it. At some point, someone's going to come to you and say, 2 + 2 is 7. How much energy do you put in debating with them that 2 + 2 is 7, right? It's not 7, it's 4. I'm going to tell you it's 4. And if you still tell me it's 7 and you're bringing your mathematician from wherever he comes from or she comes from to show me why it's really 7 and how mainstream media convinced me it was 4, it's not a conversation we can have. And we just have to know that there are going to be those that are going to be lost to this. And our goal is 70% uptake with the vaccine so that we can get to herd immunity. And so that gives us 30% that we may not have to convince. But I would not, the energy into that black hole is going to be more than you have. And I'm sure all of us are running on grit and fumes at this point. And so I would say just to move past that.
All right, and one more question in the chat. How do you deal with mandate fatigue? The local municipal messaging has gone from 2 weeks to flatten the curve to a month extension. And after months, now it's been avoiding Thanksgiving and Christmas. A lot of people are losing faith in the messengers because they don't feel the previous messaging was accurate or authentic.
Simple. Tell them what the death rate is. Tell them how many people have died. We told you that if you didn't follow it, it would get worse, and it is getting worse. And then you have to name the areas that are closest to you. I saw that the death rate has been over 3,000 a day now, when it had gone down below 2,000. And then it is still increasing, even with the pressure, even with the stay-at-home mandates. They need to know the consequence of ignoring this, that the consequence of these mandates are, and that's why I urge you to call them protocols instead of mandates. But the consequences of the protocols are significant. The consequences of not doing them is an issue of life and death.
And this isn't, this isn't manipulation. This is being honest with the public about where we are and the fact that we must do these things if we want to get somewhere. And I think, that the challenge here is that health has become so partisan. COVID has become so partisan. We all want the same thing. We're all anxious, whether you're anxious because of the virus or because of the economy and your job and your home. We need to work together to address that anxiety and get to a point where we can start moving forward. And I noticed there was a question about how do you continue to message even after vaccination rates go up? What is believed, what we're seeing is that even when you have the vaccine, there is still a belief that you can transmit the virus still. So it will protect you, but you can still transmit, hence the need to continue to be distanced and wear masks, even as we go through the vaccination. But Frank and de Beaumont are going to be working together to do some very specific messaging around vaccination. And so seeing these questions is also really helpful to us as we think through our next engagement.
Thank you, Brian. And speaking of vaccinations, the previous question you just answered, leading into the next question about personal physicians and their role in messaging. Sometimes people only trust their personal physician for medical advice. What do you guys recommend and think about that?
Brian?
Personal physicians have always been useful. The challenge, of course, is now there are physicians who are not necessarily pro-vaccination. And people will find those folks. And so I want to just really get back to having family and friends and having informed messaging, arm your communities with positive messaging. Don't make it be every time that you're behind a podium, that's when the messaging comes out. This messaging has to be constant. It has to be a drone in your ear of like, well, my mother said she's going to get the vaccine, and my brother's going to get the vaccine, and my best friend's going to get the vaccine. I think those have some real ability to influence people. Hopefully, physicians can be contributing, but I mean, honestly, how often do we see our physician? Right? For many of us, it's once a year for 15 minutes. But we're seeing our family and our friends every day. And even employers who want to put out strong messaging in support of the vaccine. We all, and I think those messages that Frank had up earlier, use that language and be consistent with it. I think that's a piece that we miss. Like we want to get artistic with our language when we need to just keep the message simple and consistent, and really arm. Every brand out there has these brand ambassadors. Think of who you as a county official, who are your vaccine ambassadors, right? Who are you giving messaging to so that they can be consistent with it? I encourage all of you to bring every faith leader you have together and say, okay, on Sunday, everyone hits vaccines are important. It's to protect your neighbor. That's a main tenet of most religions. That should be the sermon. Throughout your whole county, one weekend, just hit it hard. And those kinds of thoughtful strategies, I think, could be helpful.
Awesome. And this one is from NACo. So the messages that you put up, Dr. Luntz, about what's effective and what words to use, have they been weighted to take under consideration the cultural and ethnic differences in populations and what would resonate with certain populations of your community versus others?
Yes, they have, and I'm going to give you an example. I was actually just looking this right now. Here we go. Do you personally know someone who closely died from COVID-19? Among the overall population, 23%. Among African Americans, 34%. That's a lot of people. We're going to be looking at it again shortly. And we're going to, and I think the number is going to be even worse. How serious is the current situation with COVID-19? Among African Americans, 60% say it's extremely serious. And that's because they know of people who are dying. They know what the impact is of the failure of communication, of the failure of the correct response to the virus, and they're living it right now on a daily basis. And I'm going to show you the language behind that. I apologize to have to run through all of this. Whoops, damn it. And let me try one more time. This is the challenge of where we are right now in a Zoom situation. What's more important to you regarding COVID-19? Health and safety. That's how you, for the rest of the overall population, health and safety come in first. Among African Americans, it comes in first by far, first and second. So those are the two phrases that you use because those are the two phrases that resonate so strongly. And the other stuff, the well-being or personal responsibility, drop it because they simply don't resonate with the community as well as health and safety does. One of the things that we did in this research is we actually asked them to choose specifically what words, what phrases, what facts would matter. And this is one of those where, because I've dealt with health experts who say, but I want to tell them this, and this, and this, and this. And I say to them, you don't have that opportunity. You got 7 seconds, which means you got 10 words, which means you're going to say and like. So really you got 5 words: health and safety, for your health, for your safety, and for the health and safety of your family and your friends, then finish the blank. That's the most powerful thing that you can do in the African American community. Nothing else comes close.
I have been dropping into the chat some of the links to the materials, other messaging cheat sheets. I just put something in from a project called Phrases, Public Health Reaching Across Sectors, that uses a metaphor of that health is the foundation really of our communities, just like the foundation of our house. And if it is flawed, if it is broken, then our house is weak. And so this isn't about blue, red, donkeys, elephants. This is about there's not a single thing that you want to do in our society that you can do if you're not healthy. If you want better test scores, you got to be healthy for the kids. If you want folks to not drop out of school, they got to be healthy. If you want the business community to have people show up on time and ready to work, they got to be healthy. So if we can agree that health is something we all need for any goal that we want, we may start to make some inroads there. And Phrases was done with some messaging research from the Frameworks Institute. I encourage you to check that out. It's a good resource for how to talk about health across sectors.
Thank you. And Dr. Luntz, that slide you showed was so important. We've talked about words that we can use that would resonate to certain populations. What about channels? Are there certain channels of receiving information that certain populations are more receptive to than others?
Yes, but the problem with that is that you've got people who are getting their news to affirm themselves rather than inform themselves. So they're simply watching those things that they already agree with. And so they're not getting any new information that would allow them to behave in a safer and a healthier fashion. The written word is still the most impactful word. The problem is that so few people now get their information from the written word. So often they're getting it from websites, they're getting it from television, and it's all video communication, which is impactful but superficial. If I could wave a magic wand, I would tell people to communicate in a USA Today format. I would do a compromise between the written and the visual. To do the written, but in a more visual fashion, which is shorter paragraphs, shorter sentences, more simple directives. Still write it down because it will be followed, but write it down in a simple way, in a clear-cut way. And probably the most frustrating thing of all is when you come on to a science or a healthcare website and the paragraphs are 10 or 12 or 14 lines long, which I know that they're only going to be read by people who graduated from Ivy League schools, which isn't too many of us. So cut it out. If you want people to understand it and follow it, write it in such a way that they can understand it. And I realize I'm being provocative, but it's not working. Why are we still losing more than 3,000 people a day?
Mm.
Something is not being said correctly. We used to be the smartest population, the most commonsensical population. We were so proud that we won every war and that we created all this great innovation and that we found so much, that all the great discoveries were coming from us. Well, you know what? All the great stupidity is coming from us also. And I don't accept it. And I blame the people themselves only partially. I actually blame the elites for not connecting on the right level with the right tone on people that we need to reach. Look, if you speak Greek, then even the smartest people aren't going to understand you unless they understand Greek. And there are too many people in the profession of keeping people safe and healthy that are communicating Greek when they should be communicating simple, plain English.
Let me ask a question right quick, Dr. Luntz, around hip hop and how it plays a role in our society. Talk about how hip hop can play a role in getting the message across about the vaccine.
I want to do a song. I'm not having each artist come up and say, hey, I took the vaccine and show a picture of it. Do a video with your leading artists, all of them in doctors' offices, all of them getting the vaccine while doing some amazing collaboration. Hip hop, more than any other form of music, you never know who's going to show up on the single. And now I'm sounding old. You never know who's going to show up on the track. They have the weirdest combinations, and it gets attention. So create a half dozen weird combinations of people who everyone hears that they're hostile. And Jay-Z may be angry at Kanye, or just put people who are mad at each other, who are feuding with each other on the same song together, getting inoculated together. And Brian, that's one of the things we got to figure out. Is it a shot? Is it a vaccine? Is it inoculation? What is the phrase that describes it? But Commissioner, you get 6 of them on the same track, using the same beat, telling people, don't be a fool, do this, and they will absolutely pay attention.
Great, thank you.
And actually, that needs to be my last one. I've got to run. I desperately wanted to do this because I think that the people on this call are going to have a greater impact than anyone else that I'm talking to right now. I was in the Middle East for the last 10 days. I only got off a plane about an hour and a half ago. And I'm going to fall over. And I won't even make it to get my vaccine if I don't somehow close my eyes for about 10 minutes. And I'm so scared that I'm going to do it with you looking at me.
No.
That I want to jump off. But please find a way to find a way for me to get a hold of you. I think I'm visiting your state.
I need to talk to you. So Blair, make sure we connect, because I will be available, because I want to bring the hip hop folks together so we can do something.
That'd be cool.
All right, thanks.
Okay, Brian, take it from here.
Thank you. I just saw the Arizona question. I mean, gang, I think it is just really trying to get to people that right now we are staying apart so that when we gather again, there are fewer missing. As we went into Thanksgiving, as we're going into Christmas, we have 300,000 people who are not here for this Christmas. That's, almost 60,000 more than we had for Thanksgiving. We are losing people. And I think it's important. One of the things that we've talked about is, how do you help people understand what 300,000 people are, right? And so use something that people can visualize, the number of 747s, the number of 9/11s. We've seen a death rate that it's 1,000 9/11s, right? Those things people can really start to grasp. And so, just having folks really encouraging that right now is not the time to stop. This is like, if you're a football fan, and I am a huge football fan, you ever seen that time where the guy's heading to the end zone and he drops the ball at the 1 and keeps running into the end zone. And it was one more yard. You had to make that one more yard. And that's where we are right now. We've got to make that one more yard. And I understand that folks are, the gatherings, the indoor dining, these are things that are really driving our infection rates now. And we just have to keep the messaging consistent and ask people not to go. And it might not be stopping the gathering from top down. It might be stopping it from bottom up, right? If you're going to a gathering and you don't want to have, your grandparents, your kids, your wife, your whomever, if you don't want to put them at risk, you don't go to that gathering. If you go to the gathering, you are accepting an increased risk that you won't be around for the next gathering. Now that might be, I'm not going to quantify what that risk is, but you are accepting more risk. And if I could avoid, if I could increase the likelihood that I will have one more Christmas with my loved ones, I want to do whatever I can do to make sure that I maximize that.
All right, great. Any more questions, Blair? So we can close it out if we're not.
None that I see.
All right.
And please use the resources that we put a ton of resources into the chat box. Feel free to reach out to us at the Beaumont Foundation if you need assistance. Commissioner Johnson, if you need some small funding to get a good producer for the hip hop album, just give me a call.
I will do it. I'm calling Killer Mike today. Be ready. I want to thank you both for a fascinating discussion and presentation. As we close this seminar, I wanted to highlight a couple of things that stood out to me as takeaways. First, it is important that we work across various sectors in government and government entities to come up with a unified message with our constituents they can understand and trust. I think it's key also to have a cohesive communication strategy so county residents aren't receiving different information from different agencies and local leaders, so they can have confidence in our response. Another piece of the conversation that really stuck out to me as important is the value of reaching out to all constituency, using the language that they understand and bridging the gap between those who are worried about the economy and those who want to take a more cautious approach to mitigation. Combining messaging around public health and economy and tying together is essential. Healthy counties, healthy residents mean a healthy economy. Ensuring everyone is on the same page is very critical to really getting the information done that we need. And as I stated earlier, we as county commissioners, supervisors, folks who are elected, we're the catalysts and conveners. We're where the rubber meets the road. And if the message is going to get out, it's going to require of us, because based on the polls, based on where you are, we're one of the most trusted voices around COVID and other pressing issues in our community. So we are the first line of defense against this virus. We also, our constituents, we go to the stores in our community, the grocery stores, people see us, they talk to us, they're connected to us. And so it's vital that we have the messaging down pat. So thank you all again to all of our speakers and all of you who took out the time to participate in today's webinar. Wishing you a safe and happy holiday season. Thank you, thank you, thank you to our NACo staff. You're remarkable. It's a very timely issue. And we will have this information available to you. And thank you all, and you all be safe. Bye-bye.